This is Melinda Schussler and the bone disease. This is for the bone disease assignment 2.5. The bone disease I chose to research is osteoporosis. This is a bone disease that makes the bones abnormally dense and prone to fractures. There are several types of osteopetrosis and are distinguished by the pattern of inheritance. The types are autosomal dominant, autosomal recessive, and intermediate osteopetrosis. The different types can be noted by the severity of their signs and symptoms. Osteoclasts, which are specialized cells, break down old bone tissue during remodeling. That's when the new bone is created to replace the old bone. The genes associated with this disease are involved in formation, development, and function of bone. The bones are continually being remodeled, and this process is carefully controlled to make sure that bones stay healthy and strong. The mutations in any of the genes end up leading to abnormal or missing osteoclast. Without the normal genes, the bone is not broken down when new bone is formed and creates unusually dense bones. That means that the bones are abnormal in structure, which makes them more susceptible to fractures. The major features of osteopetrosis is all underlined with the abnormal bone remodeling. Osteopetrosis can be inherited by several different ways. The most common is an autosomal dominant inheritance pattern, which basically means one copy of an abnormal gene in each cell is enough to cause this disease. Most people with this disease have inherited the condition from an affected parent. This condition is congenital, which means it's present at birth, and results from an imbalance between the formation and breakdown of the bone. Now, this is a rare disease that affects people from infancy through adulthood. The most common and mildest type is adult osteopetrosis, which affects approximately 1 out of every 20,000 people. This is also known as ADO, or Albers-Schnober disease. Within this disease, there are type 1 and type 2. Osteopetrosis is characterized by the hardening of bones, mostly in the spine, pelvis, and base of the skull. Two main complications include the bones becoming fragile and dental abscess. There is also infantile osteopetrosis, which is the most severe type of this disease. It's also called malignant osteopetrosis and is diagnosed early in life. Approximately 1 in 250,000 people are affected with this type. The last one, IAO, which is intermediate autosomal osteopetrosis, which is a form of this disease that can have either an autosomal dominant or recessive pattern in inheritance. Signs and symptoms of this form become more noticeable in childhood. It includes increased risk of bone fracture and anemia. People affected by IAO usually do not have life-threatening bone marrow abnormalities, although some might have abnormal calcium deposits in the brain causing intellectual disability and renal tubular acidosis, which is simply a form of kidney disease. Signs and symptoms of adult osteopetrosis include generalized osteosclerosis. The bones might be uniformly sclerotic, but differences may be noted in the iliac wings and near the end of the long bones. The bones may appear as having another bone within a bone or look club-like. The whole skull is dense and thickened, especially at the base. The sinuses are small. Vertebrae may show alternating bands, which are known as the rugged Jersey sign. There are some identifying factors that distinguish between type 1 and type 2 adult osteopetrosis. With type 1, the hardening of the skull mainly affects the vault with marked thickening, and the spine shows little sclerosis. With type 2, sclerosis is found mainly in the base of the skull. The spine always has the rugged Jersey appearance, and subcrystal sclerosis is always shown in the pelvis. About half of patients are asymptomatic, and the diagnosis is made incidentally. Others are diagnosed on family history, and yet others because of recurring fractures or osteomyelitis. Patients that have no symptoms usually are diagnosed while having x-rays done for other reasons. The x-ray will show the abnormal dense bones. In people who have symptoms, the major feature includes multiple bone fractures, abnormal side-to-side curvature of the spine, or other spinal abnormalities, arthritis in the hips, and a bone infection called osteomyelitis. These types of issues become apparent in late childhood or adolescence. Many patients have bone disease. The bone defects are common and include neuropathies because of cranial nerve entrapment, carpal tunnel, and osteoarthritis. Some other manifestations are visual impairment because of retinal degeneration and psychomotor retardation, although the bone marrow function is not compromised. The infantile osteopetrosis is severe and has many symptoms and signs. A couple of main signs are the failure to thrive and growth retardation. Other signs and symptoms include bony defects, nasal stuffiness, neuropathies related to cranial nerve entrapment, manifestations of deafness, proctitis, and hypothalamus. Osteomyelitis of the mandible is common because of an abnormal blood supply. The bones are fragile and can easily fracture. Defective osseous tissue tends to replace bone marrow. Patients suffer from anemia, easy bruising, and bleeding. Infections, extramedullary hematopoiesis can occur, and other manifestations which include sleep apnea and blindness. With infantile osteopetrosis, which becomes apparent in early infancy, there is a high risk of bone fracture from minor bumps and falls. Their abnormal dense skull, bones pinch nerves in the head and face, which often result in vision and hearing loss and paralysis of the facial muscles. These dense bones can also impair the function of bone marrow, preventing it from producing new blood cells and immune system cells. These severe cases can be life-threatening and are during infancy and early childhood. Treatment for adult osteopetrosis in itself requires no treatment by itself, though with complications of the disease, intervention may be required. Surgical treatment may be needed for reasons like notable facial deformity, patients with multiple fractures, deformity, and loss of function. With severe related degenerative joint disease may also be a cause for surgical intervention. There is no specific medical treatment for the adult type of osteoporosis. In regards to the patient information, I will focus on the adult type of osteopetrosis. I will give them the name of the disease, which is adult osteopetrosis, and I would explain what the diagnosis meant. Simply put, is that the genes that are associated with this condition do not break down old bones to replace with new bone, which makes the bones dense and brittle. There are two types, type 1 and type 2. The main difference is with type 2, it makes you more prone to fractures. I would also tell the positive side, which is this is the most common and mildest case of the disease, and it affects only in 1 in 20,000. This condition is hereditary, which just means that one copy of an abnormal gene in the cells are enough to cause this condition. It's characterized by hardening of bones, mostly the spine, pelvis, and base of the skull. The two main complications include the bones becoming fragile and dental abscess. There is no cure or approved medical treatment for this condition. Surgery intervention may be necessary depending on the severity of the condition. Medical devices can be used to assist as the condition could affect the mobility. Many people go on and live a fairly normal life. I can give you some additional information on osteopetrosis. Thank you.